Welcome to Leading the Way, a video series about addressing challenges in biomarker testing. Today, you will hear important insights about biomarker testing standardization in advanced ovarian cancer from Dr. Robert Neff, a gynecologic oncologist, and Ms. Courtney Rice, a genetic counselor from TriHealth Hospital Healthcare System based in Cincinnati, Ohio.
Hi, I'm Dr. Robert Neff, a gynecologic oncologist at TriHealth. TriHealth is a Cincinnati-based healthcare system operating 4 hospitals and more than 140 sites of care. Today, I'm here with my colleague, Ms. Courtney Rice, who is a genetic counselor and our Director of Precision Medicine. Courtney and I have worked together on biomarker standardization efforts to help meet the institutional goal of being a leader in oncology. Our top priority has always been to ensure that our patients receive the best care. Through precision medicine, we can better partner with our patients to customize their treatment plans.
We are very proud of what we've accomplished with biomarker testing standardization at TriHealth, and we would like to share our story with you.
In this series, we share strategies that we use to standardize testing for homologous recombination deficiency, also referred to as HRD, in patients with advanced ovarian cancer. Here, we will share how we monitored our testing orders with commercial labs. Monitoring the status for testing orders and addressing matters that required follow-up could be very time-consuming, and as a result, this would lengthen the time taken to receive test results. So we decided to transfer this task from the primary nurse in the clinic to a new role, the Precision Medicine Testing Coordinator. In this dedicated role, the coordinator acts as a liaison between the testing physicians and the commercial labs. They work closely with the local pathologist to ensure that the tissue is submitted. They follow up to make sure that the sample has met the quality control criteria and the results are being processed in a timely fashion. With the Precision Medicine Coordinator in place, we established a more efficient process for monitoring and following up with commercial labs. Overall, we decreased the turnaround time for receiving results, made treatment decisions more efficiently, and our clinical staff had more time to focus on patient care.
To hear more about approaches to testing standardization, please click the link below.